fertility treatment, made for people who struggle to have children due to medical issues. But what if your sexuality is the issue? The UK has come a long way in LGBTQ+ rights since the decriminalisation of homosexuality in 1967. The government voted to approve same-sex marriage in 2013, giving LGBTQ+ people equal rights in relationships. But do these equal rights extend to having a child?
People have to decide between putting a deposit down on a house potentially and fertility.
I can't just keep on getting myself into debt, because what I don't want is to be in debt and then have a child.
To find out that depending what sort of relationship they're in or where they live in the country could depend where they get NHS funding is really kind of a hard thing to have to say to people.
I think it's quite clearly a case of direct discrimination against people of a certain sexuality and people with a certain gender partner.
Having the option to make the family that you wish to make is a human right, and it should be made a priority. It has huge health implications if you can't do that as a human.
This is Two Mums, the cost of starting a family.
I remember when I came out to my parents, one of the first things my mum said to me was, "You'll never be able to have your own child." Because at that point in time, that was the truth. And so I think when we got to the stage of we could be able to have a child, I felt so grateful that we were able to even do that process. But I think the cost at that time, it was like, okay, that's just how much it costs. And now on reflection, it is like, wow.
Ellie and Sam decided they wanted a child in 2016, and after 2 cycles of IVF, their son Harvey was born in September 2020.
The joy that he brings and the love that he brings to us is just phenomenal. Yeah, I say to people, it's the best money I've ever spent, but should we have had to spend that money, I guess is the question.
They confirmed to me that the money spent on IVF was in the tens of thousands of pounds.
People have to decide between putting a deposit down on a house potentially and fertility, and a lot of people go, a house, and that's their choice, but should it be a choice, or should everybody have the right to be able to have a child if they so wish?
In the past 10 years, the number of female same-sex couples like Ellie and Sam seeking fertility treatment in the UK has quadrupled, according to data from the HFEA. But they face barriers in their access to treatment that heterosexual couples do not. So to have a baby on the NHS, the National Institute for Health and Care Excellence, that's NICE for short, lays out the guidelines for who is eligible for free treatment. So on their website, it says that women aged under 40 should be offered 3 cycles of IVF treatment on the NHS if they've been trying to get pregnant through regular unprotected sex for 2 years, or they've not been able to get pregnant after 6 to 12 cycles of artificial insemination. These 6 to 12 cycles of artificial insemination cost thousands, and NICE added this last clause in 2012 to increase inclusivity for same-sex couples. But what this effectively means is that same-sex couples have to pay thousands to access the treatment that heterosexual couples are accessing for free. So what options are available to same-sex female couples? Artificial insemination or intrauterine insemination uses donated sperm from someone you know or from a sperm bank. The better quality sperm is injected directly into the womb in the hope that this will lead to a pregnancy. According to the British Fertility Society, the success rates for this treatment are actually quite low at around 15%. So although it is the treatment required for NHS access, many same-sex couples bypass it completely and just self-fund IVF. IVF involves collecting eggs from the person and mixing them with sperm in a lab to fertilise them. If successful, a resulting embryo can be transferred directly to the womb where it should grow a baby.
My name is Claire Ettinghurst and I'm Director of Strategy and Corporate Affairs at the HFEA. The HFEA stands for the Human Fertilisation and Embryology Authority, and we were set up over 30 years ago as the UK-wide regulator of fertility treatment and embryo research. Depending where you live in England depends what sort of access to NHS treatment you have, and that's particularly accentuated for female same-sex couples who are finding they're having to go through lots of different barriers to treatment really before they're able to access NHS funding. And we really think that's completely unequal and unfair.
Access to fertility treatment is a postcode lottery, as different couples are told to pay for different amounts of cycles to access that free treatment depending on where they live.
Although there is national guidance through NICE, which requires clinical commissioning groups to provide fertility treatment, these decisions are taken locally depending how much money there is in their budget.
Sam and Ellie were not actually offered any free rounds of treatment, which they are entitled to according to government guidelines.
All trusts should have the same testing. It shouldn't be a postcode lottery where you live means you do or don't get help or assistance. And I think the money that's involved in having fertility is out of reach for so many people, and that shouldn't be the case, because having a family is important and life-changing.
Not all women and people feel that they should be entitled to free treatment. Kelly is a lesbian who is currently undergoing her first cycle of IVF. She questions the role of the NHS in all of this.
The NHS is there for if you're sick, and being in a same-sex relationship doesn't mean that you're sick.
Kelly has polycystic ovary syndrome, a condition that can lead to difficulties getting pregnant. She leads a healthy lifestyle to maximise her chances of success in IVF and believes that if you have fertility issues, then you should be offered access to free treatment.
If I had infertility problems, even though I'm with a woman, they wouldn't have given me any assistance. And I think that's wrong, because if I was with a man and I had infertility issues, I would be put forward straight away.
Kelly told me that she has bought a package for 2 cycles of IVF costing £15,000, but the cost of fertility treatment initially led her down a different route.
I've thought about it, and they said, they understand it's not natural insemination, it's artificial insemination. And then when the time comes, the messages start changing, and they're like, oh, but your chances are higher if we do it naturally. And I'm just like, forget that. And in the end, I wasn't comfortable doing it anyway, but because of the cost, sometimes you do put your safety to one side.
Marta is from the British Fertility Society. I asked herself and Claire to tell me more about the dangers women might face if they decide to take the unregulated route to avoid the high costs of private clinics.
Well, there's first risks about the sperm itself that you're putting in your body. If the person that has produced the sperm has not been tested for certain diseases, you could end up with a sexually transmitted condition. You also potentially don't know about the genetic background of that person, or even about their motives for donation, and that also links to the legal sort of implications of this.
The clinic has to make sure that the people who are having the fertility treatment are the legal parents of any children born and not the donor, which is why it's so important, if you're using donor sperm, to go through a licensed clinic. If you don't, then there are risks that the person who donated the sperm in years to come could then have claims on that child as a potential parent.
I asked Kelly how much more she can take.
I can't just keep on getting myself into debt, because what I don't want is to be in debt and then have a child. And it just scares me how expensive it could get if these 2 rounds don't work. So for me, I feel like if we bought this package, if we use it all and we're still unsuccessful, then that's it. Everything has to have an end. And if that's where our end is, then that's the end, and I just won't have children.
Our baby girl Etta was born in September 2020, so she's 19 months now.
What was that like, finally having her in front of you?
Yeah, incredible, absolutely incredible. We both cried a lot of those first few months. It was something that I'd wanted for a really, really long time. Sorry, I don't know why. Yeah, it was something that I'd wanted for a really, really long time.
Jo was told she would require 10 rounds of treatment before accessing any for free, and so far she has had 2 cycles of IVF and has 7 frozen embryos. So in total, how much did you spend on fertility treatment, if you don't mind me asking?
Up until this point, we spent just short of £18,000.
So if you had to do the 10 that they said, that's 18 grand times 5. We're looking at £100,000.
We couldn't do it.
After speaking to Jo, I wondered why people are paying so much for private treatment. Marta is also the Director of Embryology at BPAS, a not-for-profit fertility treatment service. She told me that as well as facing high costs, some people undergoing fertility treatment in the private sector are offered what she called add-ons, extra treatments that may not increase their chance of a successful pregnancy.
Fertility patients, whether they're same-sex couples or single people or heterosexual couples, they are in a position of desperation. They really are vulnerable. And as a patient, if you're told, this might help you, we're not sure, but it might help, you will go for it, because the guilt trip that you have if you don't get pregnant and you haven't used one of those things is really, really, really hard. So I think, there is some playing with people's emotions there, and there's an imbalance of power.
Jo was shocked at the discrimination that she felt she had faced throughout her journey. She contacted her local MP wanting to highlight the issue, but she did not get the response she was hoping for. Jack Lopresti did not respond to our request for comment.
I felt it was a vague, generic response, very impersonal. It says here, the criteria and the guidelines were developed as a way of achieving equivalence between opposite sex and same-sex couples in establishing clinical infertility and accessing National Health Service fertility treatment services. They don't meet that objective.
So if you could speak to the government right now, what would you say to them?
I think it's quite clearly a case of direct discrimination against people of a certain sexuality and people with a certain gender partner, and I don't see how it can continue. It's not fair, it's not right, and it needs to change.
Women and people like Jo across the country are campaigning about the cost for same-sex couples to access fertility treatment. So where is the government on all of this? Apsana Begum is a Labour MP for Poplar and Limehouse. She has asked the Health Secretary on multiple occasions about IVF access for same-sex couples.
For anybody of any background, it's very difficult to be in a situation to have to consider IVF treatment, but it shouldn't be. There shouldn't be additional barriers because of sexual orientation to be able to access IVF treatment in the UK.
And what is the government currently doing about it?
I think not enough. I think that's pretty clear that not enough, and I think that's the response to the question that I tabled reflected that healthcare shouldn't be based on sexual orientation. It should be equal and fair regardless of background, and that's where we need to get with a fully publicly funded NHS service that is the same across the board wherever you may be in the country.
The Department of Health did not respond to my request for comment, but in their written answers to Apsana Begum, they said,
"No specific assessment has been made. We expect local NHS commissioning bodies to commission fertility services in line with the NICE guidelines to ensure equitable access in England. NICE guidelines were updated in 2013 to include provision for female same-sex couples. However, the department has agreed with NICE that the fertility guidelines should be reviewed, and scoping for the review has started."
It was clear from the start that current NICE guidelines and individual clinical commissioning groups are leaving same-sex couples facing high costs for fertility treatment that heterosexual couples can access for free. But this lack of access to the NHS also leaves people who desperately want to start a family exposed to the prices of the private sector, which, as we've learnt, differ massively case to case. Although there is anger and disappointment from the LGBTQ+ community, there is also a feeling of hope. With NICE reviewing their guidelines and women and people being voices for change, same-sex couples may not face the same barriers in years to come.
We try and feel as lucky as we possibly can for everything that we've got, so that's kind of our positive take on it.
I would see all these pregnancy announcements. I'm happy for them, but for me, I'm like, when's it going to be my turn?
I'm more fulfilled now having a kid than I ever was before, and I felt like I was fulfilled, and I felt like I'd had it all, and now I'm like, wow, it's just next level. It makes you feel like you have a purpose. I had really poor mental health before we had him, like really, really bad, and he's changed me as a person fundamentally, and yeah, I can't imagine him